Well, y'all welcome again. We are here to provide information to keep the people of the state informed. We're happy to have with us signing Holly May and assisting Sharon Reed. And I call on Chaplain Denny for prayer. Chaplain.
Thank you, sir. Psalm 118 says, "This is the day that the Lord has made. Let us rejoice and be glad in it." If you would, please pray with me. Gracious Lord, we do thank you for this day, and help us to rejoice and be glad in it. There's so much good that's going on in the midst of all the chaos and struggles that we have. Help us to always seek those things that are precious to us, those things that you've gifted us with and that you've blessed us with. So help us to give thanks on this day. And I pray all this in your mighty and precious name, Lord. Amen.
Ladies and gentlemen, we have with us to answer questions and to speak in a moment, Linda Bell, epidemiologist, also Marshall Taylor, the acting director of DHEC, and Kim Stinson, the director of the Emergency Management Division, and General McCarty of the National Guard. As of Monday, August the 3rd, many of us will be wearing masks, keeping our distance, and taking precautions, many more of us than have been so far. Also, on Monday, August the 3rd, there will be more businesses open and operating safely than there are today. Today, I'm once again strongly recommending that everyone in South Carolina wear a mask when they are in public or in an enclosed setting and unable to social distance. Those are the rules that we've been hearing ever since we've been involved with this pandemic since March of this year. Number two, I'm calling on counties and municipalities to enact ordinances requiring the wearing of face masks, face coverings, practicing social distancing, following proper hygiene, all have been recommended by CDC and DHEC and everyone in between. And I'm also calling on local leadership. This is a time for local leadership. Local leadership is the answer to where we are going. If we're hoping for the best, but we need to prepare for the worst. And the way to prepare for the worst is to have local leadership involved in stopping the spread of this virus and keeping the people safe. One size does not fit all. Local authorities at the county and city level, municipal level, town level, of which we have 271 in South Carolina, all have access to enforcement authority, and it should be exercised. Number three, I'm ordering that effective Monday, August the 3rd, masks or face coverings will be worn in all state government offices and buildings according to the social distancing guidelines and procedures that have been developed by the Department of Administration and posted on accelerate.sc.gov. That is the Accelerate SC website, and it is active, it is up to date, and I urge anyone who has questions to go to that website. Number four, effective Monday, August the 3rd, South Carolina restaurants will be required by law, not recommendation as now, but by law, to follow the guidelines and recommendations issued by Accelerate.com and crafted by DHEC and the South Carolina Restaurant and Lodging Association. Everyone is familiar with these. They've been in effect for some time, and the restaurants have asked us for this help. There are some people who have not gotten the message, who need to be reminded, so this is now a mandatory. Restaurants will be required to limit dine-in customer service at no more than 50% of the certificate of occupancy issued by the fire marshal. That was an Accelerate SC recommendation. That is now the law. Restaurant employees and patrons will be required to wear masks or face coverings. That was an Accelerate SC recommendation. It is now the law. Tables are required to be spaced at least 6 feet apart. No more than 8 customers may be seated per table unless they're from the same family. Again, that was a recommendation. Now it is the law. Standing or congregating in the bar area of a restaurant is prohibited. Say it again. Standing or congregating in a bar area of a restaurant is prohibited. As you know, we don't license bars, we license restaurants, and some of them have bars. Well, standing or congregating in a bar area or a restaurant is prohibited, and already prohibited is the service or consumption of alcoholic beverages after 11 p.m. in a restaurant or a bar. These requirements apply to all establishments that possess a state permit to sell alcohol. The Parramatta Priority Program, which you've heard of, it's like one in Greenville, it's like one in other places, but the Parramatta Priority is statewide, and it has approved 2,554 restaurants. That is, has given them that good seal, housekeeping seal of approval, so to speak. Restaurants should still apply for this sticker, so customers will have confidence that these requirements are being followed behind the scenes, like in the kitchen, the training and cleaning and hygiene and all of those things. Now, the rest of the restaurant requirements may be found at accelerate.sc.gov. Now, I remind you that throughout this, enforcement is important. These restaurant guidelines are enforceable by the state government, and that is through the State Law Enforcement Division, Department of Revenue, and DHEC, all of which, well, DHEC and Department of Revenue, which involve licensing, and SLED, of course, has criminal authority. Number 5, I'm announcing that effective Monday, August the 3rd, the following types of businesses, facilities, venues, events, or mass gatherings, these have been covered in an earlier order, the following types of businesses, facilities, venues, events, or mass gatherings, such as festivals, parades, concert, theater, stadium, arena, coliseum, auditorium. You keeping up with me? All right. Hall, amphitheater, gymnasium, chamber, assembly, concert hall, dance hall, nightclub, performing arts center, park, racetrack, or similarly operated entities. On Monday, August 3rd, those types of businesses, facilities, venues, events, or mass gatherings may operate, but under these conditions, and this will be enforced, attendance may not exceed 50% of the certificate of occupancy issued by the fire marshal or 250 persons, whichever is less. Customers, participants, and employees must wear masks or face coverings, as well as follow social distancing, cleaning, and hygiene practices as recommended and posted at accelerate.sc.gov. The sale of alcohol, as mentioned, shall end in all of these places, as previously announced, at 11 o'clock p.m., just like in the restaurants and bars now. Now, there can be exceptions to this rule. The exceptions and clarifications to these restrictions may be granted by the State Department of Commerce only upon a thorough and satisfactory demonstration of an ability to comply and operate according to federal and state coronavirus procedures and protocols. Now, these restrictions that I've just announced on businesses, facilities, venues, events, and those things that I listed do not apply to these things: the conduct of official business or meetings of state, county, municipal, or local governments, colleges and universities, K through 12 schools, or any political subdivision of the state. Also, these restrictions do not restrict the normal conduct of local or statewide elections, voter registration, or absentee voting. But they do apply to, for example, Frankie's Fun Park, the one here in Columbia. The customers and employees have to wear masks when they go in there. Hollywood is knocking, and our movie theaters will be ready to open. They're going to have to follow these rules. You go see your favorite movie, you're going to have some distancing, you have to wear a mask. High school football games will be able to be played if the high school league plan is approved by the Department of Commerce, because of course that would be more than 250 people. And so that will be, that will require the an exception to the 250 rule. Now, in accordance with the South Carolina Code of Laws, I hereby authorize and direct any county or city official to enforce the provisions that I have outlined of this executive order and any prior or future orders issued in connection with the present state of emergency. I want to say that again. I want the city councils, the county councils, and everyone, the towns, everyone in between to know that in addition to the state authorities that I mentioned, those in licensing, DHEC, and Department of Revenue, and the criminal investigatory authorities, that is SLED, in accordance with South Carolina law, I hereby authorize and direct any state, county, or city official, any officer, to enforce the provisions of this executive order and any prior or future orders issued in connection with this. The penalty for violation of the provision in these orders is a misdemeanor. That is a crime. And upon conviction, the violator must be fined not more than $100 and imprisoned not more than 30 days. Now, as y'all know from earlier conversations and orders and restrictions that we've had, and we have not had them like they have in other states, and we're doing better than other states. Our unemployment rate has dropped from around 12% to below 7%. I think last week we had the lowest number in a week of unemployment claims filed since this began. We have businesses that are ready and willing to open. But if we're going to open the businesses, we're going to have to be careful. That means you got to wear a mask. You got to keep that distance. You got to wash your hands. You got to be careful. And we know it's the young people, as more and more young people are testing positive. Now, they're not getting sick. Some don't even show it. Some don't even know it. But they're getting sick at a high rate, particularly recently. And who typically suffers is the older generations. So we've got to be real careful. But if South Carolina's business is business, and South Carolina's important task is keeping our people safe and healthy. And the way to have our businesses open and flourish and put our people to work is to be safe by keeping your distance, wearing that mask, washing your hands, and being careful what you do. These restrictions are temporary, they're measured, they're targeted at what we know works. They're enforceable by the state, by DHEC, by the Department of Revenue, by SLED, and by local law enforcement, local fire marshals, and local government. Local government also has authority on permits. They do not close businesses or constitute a taking of anyone's income or personal freedom. We are not going to close down South Carolina. We went in with a measured, steady, deliberate approach, and we've come out, and we are not going to go back there, and we don't need to as long as we heed these safety measures. These limited measures give South Carolina the best chance to slow down the spread of the virus while keeping our economy open and running and the jobs flowing. Some people will call for some more closings. We're not going to do that. It's not good for our mental health. It's not good for our economic health. It's not good for families, and it's not good for children. These measures are likely to be criticized. That's all right. It seems like everything we do is criticized, praised by some, not by others, but in the long run, we are confident that these things will work, and that's why we're doing them. So I urge all South Carolinians to continue to be courteous and conscientious to their neighbors. Try to be patient, and there will be many times when your patience will be tried. Follow the recommendations, wear a mask, wash your hands frequently, keep that distance, and use common sense, and practice grace. We will get through this, and as a young writer said just recently, wrote, quote, "Grace does not react, it responds. Grace does not yell, it speaks." So in South Carolina, we are known for the way that we react to tests, to trials. We are strong people, we are smart people, and I believe that we have the best plan in our state for our future right here in our hands. Dr. Bell.
Thank you, Governor, and good afternoon. Today we announce 1,666 new confirmed cases of COVID-19 in our state and 48 new confirmed deaths. This brings our state's total to 85,423 confirmed cases and 1,551 confirmed deaths. We have reported at least 1,000 new confirmed cases of COVID-19 every single day, except for one in the month of July. And sadly, we continue to announce a high number of confirmed deaths as well. A detailed list is available from our daily news releases, and our website shows deaths grouped by the dates of deaths. On average, deaths from COVID-19 occur approximately 2 weeks after an individual develops symptoms. And since we've seen some of the highest numbers of case counts in June and July, we are now seeing higher case counts of deaths. I want everyone to understand that we each have a role to play to reduce these high numbers and these deaths. And it really doesn't require a lot. We have low-tech, simple practices available to everyone, and it has nothing to do with access to care or access to medications. The simple measures are wearing a mask and physically distancing from others when you're outside your home. These are very effective interventions to prevent disease spread in entire populations. We've seen these measures work in many settings, and in 4 to 6 weeks in South Carolina, if we routinely and stringently adopt these measures, we can be in a completely different place in a relatively short period of time. COVID-19 testing is available throughout the state, with currently more than 105 testing events scheduled through the end of August. And testing is key in providing information about where disease is occurring within our state, and it helps us to identify hotspots and other key points. But what is really most important is that we practice the daily precautions of mask wearing and staying physically distanced from others, and making sure that you stay home in isolation if you do have symptoms or if you've tested positive. But we ask people to use common sense in an approach to making sure that testing is available for all of those for whom it's indicated. Individuals who stringently practice the recommended precautions will significantly reduce their risk of exposure and of contracting disease, and they should use common sense when seeking testing. The CDC recently updated their guidance, and individuals who were previously recommended to get a negative test to be released from isolation may now be released based on recovery of symptoms. So instead of being tested repeatedly until an individual gets a negative test result, if they've previously tested positive, a person may be released from isolation when they meet 3 criteria. At least 10 days has passed since symptoms onset, and at least 24 hours being fever-free without the use of a medication that reduces fever, and that other symptoms have improved. We can completely reverse our fortunes and create safe environments for our business recovery, for our lifestyle recovery, and particularly for students returning to school in a few short weeks. This is more important now than ever as we move into the fall and winter, when we will be confronted with the flu season. Fortunately, several local governments in the state have been requiring face masks for everyone in public, and as the state's public health agency, we strongly support those measures and those local leaders' initiatives that are centered on protecting the health and well-being of their communities. Many businesses like Michelin are doing this today, and we hope even more businesses and others will rally to support these initiatives even without requirements. We continue to remind South Carolinians that this is a virus that can be spread from person to person by breathing if an individual is not wearing a mask. So it's very hard to control unless we do something dramatically different. We're asking everyone to share the responsibility in caring for others and helping us fight against this deadly disease. So what we all need to do, again, is to wear a mask when around others, to physically distance from others by 6 feet, to avoid groups and gatherings, to wash your hands frequently, and to follow the advice of healthcare professionals, of case investigators and contact monitors who are working tirelessly to prevent the spread of COVID-19. Thank you.
Thank you, Dr. Bell. Just a few notes. You may be interested to know, just in this month, mainly from the July the 19th, 20th, and up through 23rd, 24th, 20th, a lot of our big businesses that national chains that are in the state, have mask and distance ordinances. And it's quite an impressive list. I won't go through all of them, but Walmart has 110 stores. They are using these rules. Kroger with 35. All these are using these rules. The same ones that DHEC and the Palmetto Priority and all have urged. Walgreens with 155 stores, CVS with 191, Lowe's with 50, Best Buy with 13, Costco with 6, Home Depot with 25, Target 19, McDonald's 258, Publix 59 stores, Starbucks 47 stores, AT&T 83, PetSmart 29, Bed Bath & Beyond 13. There are a lot of retailers, big retailers, have in the last just couple of weeks have determined that now's the time to do the same thing that we're doing here today. So this is a good time. We've learned a lot from what Dr. Bell says. You see, we're learning more about this virus as we go along, but we have a grip on it now. And if South Carolina is going to prosper and the people need to be safe, what we are calling for today and requiring in some instances is just what the doctor ordered. So with that, if there are any questions, we'd be glad to try to answer them. Yes, ma'am?
Governor, a lot of people want to see football back, but of course safely. Under your new executive order with the capacity in these large venues, could we see a football game if there aren't too many people there?
Yes, ma'am. Good question. Football, everybody wants football. Everybody wants a lot of other things. We learned something from the blowfish just recently, and that is that was on the prohibited list. But what they had done over there was precisely what the doctor ordered. So now under this new ordinance, there is an exception, a way to get an exception for those kinds of things. They really did a fine job with it. But you go to the Department of Commerce, explain your plan, tell them what you're going to do, how you're going to do it, promise you're going to do it. If you don't do it, you could be in trouble, and then you can go ahead. But we're going to take it on that kind of a basis. We want those things to happen. It's a great part of American and South Carolina life, but we got to be careful. We just can't go back to normal yet.
Governor.
Yes, sir.
Governor, is there any businesses that will remain closed after Monday?
Say it again.
Are there any businesses that will have to remain closed after Monday?
No, sir.
Okay. And how many people do you actually envision to be at a college football game in the fall?
Don't know. Yes, sir.
This question is for Dr. Bell. Based on some of the guidance you just issued about avoiding mass gatherings, and in Tennessee, they recently reported over 7,000 school-age children have contracted COVID, and in Georgia, more than several hundred athletes contracted the virus as well. When you talk about avoiding mass gatherings, would you have concerns with football resuming and schools reopening with too many students in the building based on the ease of spread that you've discussed?
Well, without understanding the circumstances of those other reports of clusters of cases, the measures that we're recommending with any openings, any gatherings, as long as those practices are in place, then those will reduce the risk of exposure. So if people can choose to attend a larger gathering, but they remain social distanced from others and that they're wearing a mask, those are known to reduce the risk of exposure.
Question? Yes.
If you could address the timing and whether you wish you may have done this earlier, and why are we opening those remaining closed businesses?
Well, you can't keep businesses closed forever. Well, South Carolina's business is business, and it's been a number of months. Those closures took place, I think, on sometime in April, And those businesses the last ones that we're lifting those restrictions from have been closed for a long time. If we know more about the virus now than we did then, we know that if we follow these rules, that people will be safe and we can have our businesses opening as well. But now is the right time. And the fact that these major businesses, those that I mentioned just a few minutes ago, are doing the same thing all over the state, and of course they have information and advice from all around the world indicates that we're doing the right thing. Joe?
Governor, how does this affect Soda City Market?
Beg pardon?
Soda City Market in Columbia on Main Street every
They'll
Saturday.
have to get an okay?
They have to get a
Yes, sir.
clearance from. Okay. Also, there's a court hearing going on right now about whether you could spend $32 million on private schools or provide tuition help. If the judge decides you cannot spend that money, what will your next step be?
We'll appeal because we think it's perfectly legal under the Constitution. This is not state tax money. This is a federal grant that has come down as a part of the coronavirus effort, and it is specifically targeted for use to lessen the impact and help the recovery from coronavirus. The public school system is getting hundreds of millions of dollars. That's good. It's appropriate. We're for it. We want to do all we can to assist that, and there's other money as well available as well. But there's nothing available to the independent schools, the private schools, and it's the students. This money goes to the parents of the students who apply, and they have to meet a certain income level, be below a certain level. This is for the lower incomes, and a lot of people think that the very wealthy folks are the ones that go to all the private schools. It's not so. It's a lot of different reasons, a lot of different people that go to these independent schools, and some of them working 2 and 3 jobs to do it, and some of them have lost those jobs as a result of the virus. This money, this federal money, not state money, going to that program to help those students apply for the grant and then take that money to the school they want to go to is designed to help those students as well. Remember, those parents are paying taxes for the public schools. They've been hurt just like others with the virus. The federal government has recognized this, and that's why we're doing it. And I think there are 3 or 4 other states that have done the same thing. We think it's perfectly legal under the state constitution. Yes, ma'am.
Governor, with the rise in cases in South Carolina being in the red zone, are you guys seeing any shortage of hospital staffing?
Yes, we are, and that's one of our main concerns at this point. There are 2, we want to have plenty of beds available for patients, both the COVID patients as well as everybody else. And I have to say, we've been in constant communication with the hospitals, as in my office in DHEC, and the National Guard has been standing up auxiliary places, as well as the National Guard has been setting up testing sites all around the state. And those are 2 of our concerns. One is want to have plenty of hospital beds when and if the time comes. And we've gotten pretty close. It's gone back down. It goes up and down. But so far, there's no panic. There's no reason to panic at this time. And we've got great plans, so we don't plan on it. But the other thing is staffing, because you have a lot of the staffers, nurses, assistants, all sorts of people in these hospitals that some of them are just burnt out, and others are sick. They don't get sick at the hospital, but they get sick when they go home or go about the rest of their business. So we're addressing that. There are people available to come in. The National Guard has supplied some of their medics to step into that breach. We think we're going to be all right, but that is a concern. Yes, ma'am.
Governor, the latest guidance from the White House continues to recommend that any area that's considered to be in a high outbreak area have masking required. DHEC says that every county in South Carolina is under a high outbreak level. So at this point, given what the White House is recommending, why not push it statewide?
Well, that's what we're doing. That's exactly what this is.
Why not order it statewide?
Because this needs to be enforced by the local authorities, and that is the way to do it. When the going gets tough, when we have to really bear down, it's going to be the multitude of local authorities that do that. This is not an air war. This is a ground war, and we have to have not hundreds but thousands of troops on the ground, if it gets to that, to see that these precautions are taken. But what we're doing here, virtually today, without what I have said today, almost 3/5, almost, close to 60% of the people in the state are already under either a recommended or a mandated mask ordinance. We're filling in those gaps today. Yes, sir.
Governor, I'm curious, what's your reaction to Superintendent Molly Spearman approving plans that did not include your suggestion of 5-day-a-week instruction?
I think that Superintendent Spearman is doing a fine job. On the conference today, her report was that they had delivered over 20 million meals to students since this thing, that's at home since this began. Sometimes with National Guardsmen and women driving the school buses. What I believe that our first preference should be is face-to-face teaching in these classrooms. There's no substitute for a live, trained, skilled teacher, and we have an abundance of them. As you know, I've been wanting to pay them more. We got some pay, and we got another $3,000 raise that was stopped by this virus. But the teachers, we know that the teachers are important. The superintendent knows that as well as anybody. And the first preference of most parents is to have those children in face-to-face with the teachers, particularly the younger students. And as you get up to high school, it's a little easier to go virtual. So what we want is for those schools to be available for everyone who wants face-to-face 5-day instruction. Get it done. There are ways to get it done. Those that want virtual, that needs to be an option as well. But I have repeatedly confirmed that we will do everything we can with PPE, that is the personal protective equipment. In a meeting earlier today, which we've had many of since this began, we are confident that we have those resources available, that we can get them to the schools. Those arrangements are being made now. So we want to educate the children. And we know that if a child misses 2 or 3 months of school, it's rough to catch back up. And if you go in longer than that, it even gets worse. But the real tragedy of this is the children that need to be in the school the most, that is, a lot of them in the lower income or the rural areas are the ones that the lack of face-to-face instruction will hurt the most. If you have working parents, they got to go to work. They can't stay home and help a young child do something virtual. They just can't do it. So that's why it is important, particularly in those lower grades, to do all we can do to get those students into those classrooms. Yes, ma'am. Shauna?
Speaking of those White House recommendations, they actually recommend that we have 25% capacity in terms of indoor dining and completely close bars and other venues. Why not do that?
That's what they recommend, but as you know, Dr. Burks has been here. The Vice President's been here. Seema Verma has been here, and they've all said that we're on the right track, that we're doing the same thing. They've been very supportive of the steps and the efforts that we're taking, and I'm confident when they learn of these, which they don't know of yet, I presume, unless they're watching this, they'll be very, very supportive of this as well. Yes, sir.
I'm not sure if you've seen all the things SC for Ed has done this week in terms of voicing their concerns about returning to the classroom at this time. If they have to go back to keep their jobs and return to the classroom, would you do something in terms of hazard pay or make some sort of compensation for them if they truly feel uncomfortable going back at this particular point?
Well, there are a lot of people that are would be entitled to hazard pay, particularly those that are in law enforcement. As you know, earlier in this episode, we've developed a system where when a law officer is called to a dispute or something, violence, that they would be alerted with a yes or a no on whether anyone at that location in the last 2 weeks had been anyone registered or living at that place, had been tested positive. No names or any of that, but it gave them just one more little advantage in going in. there's so many calls that law enforcement go on. This gave them a little bit of comfort, but there's no hazard pay involved, and that's hazardous duty anyway. Now, what we have pledged to do in education is to provide every single resource, all the cleaning equipment. I think Anheuser-Busch has got hand sanitizer. They just recently today promised 2,400 gallons. Christie Hall at the Department of Transportation is making it by the gallon. We'll have all of that available. All they have to do is ask. And the shields, face masks, cleaning, all of those things, we have the capacity and are willing to do all those to get the teachers back in. We want to keep our teachers safe. They are important, critical to the future, but those children need to be in class. Yes, ma'am.
I have a question about elections, Governor. Do you have any response to the letter you received asking for easier access for mail-in and absentee ballots for November?
Well, that'll be a question for the legislature. Will involve a change in law, so that needs to be handled by the legislature. Yes, ma'am.
Anything else we can learn about the PPE situation? You mentioned in going back to school, you believe we have plenty of PPE to give students, parents, faculty, and staff. Do you also believe that on top of that, we still have enough for all of the hospital workers and people in all of our...
Well, we're working to see that we do, and we've been pretty close to the edge a number of times. There's some places in the past where we couldn't get it, but now it's being produced in big quantities, and we're working around the clock to see that we in the government can get as much as we can to have it available. But also all the hospitals and private institutions are all doing the same thing, seeking the market. Kim Stinson, could you address that, please?
Yes, sir. Yeah, right now we're in pretty good shape with PPE. We built a pretty good reserve. What's really helped out is the commercial distribution system. That's much improved since it was early on in the process. Just as an example, since the 1st of March, commercial medical distribution companies have provided over 250 million gloves to here in South Carolina. So right now, all we're dealing with at the EMD level, here at the state level, is emergency resupply. And we occasionally get somebody that for whatever reason can't get it through the normal system, and they'll ask us, and we'll get it down to them. I think we did 2 this week. And then in terms of the Department of Education, they're ordering or have ordered quite a bit of PPE. Much of it is non-medical, I think, cloth masks. And then we're also helping them out, as I think the governor already mentioned that. We're going to help out with cloth masks, face shields, and gowns. So we're going to do whatever we can do to make sure that they get back into business.
The one thing that we don't have that we're hoping to get soon are some testing machines, the Abbott machines and others that can give you the result of a test in just minutes. We don't have those. The federal administration is working around the clock to see that we get them, and we'd be happy to take as many as we can get, because those would be a tremendous help to us. Yes, sir, Joe? Joe?
Governor, Republicans in the U.S. Senate are talking about cutting the unemployment benefit from $600 a week to $200 a week, and then starting in October, going to 70% wage replacement. Do you think $200 a week is enough to be on for an unemployment benefit, and do you think Duke could actually transition to a 70% wage replacement system?
I know that I don't have the answer to that, or what would be the right level. That's what's being debated, but I know that I think the latest statistics I got from the Department of Employment and Workforce, something almost $8 billion has gone through the Department of Employment and Workforce. I might have that. I mean, there's a lot of money that's come in too, but the big answer to that question is not more and more unemployment, but getting people back to work. And part of getting people back to work is having schools open so the children can go to school. Everything is tied to everything else. So we are trying to do all of those things to see that our people get back to work, and they don't need unemployment insurance. Yes, sir.
This question is for Dr. Bell. Dr. Bell, a recent study came out that found COVID-19 caused heart problems in many patients who had only mild symptoms. And just your reaction to not knowing the full extent of impact of the virus and long-term on children and both adults, and again, the disease spreading in our state. And just what's your reaction to what people need to be aware of as you guys try to learn more about the virus and why it's even more important to take precautions?
Well, we've known for some time about potential complications from COVID-19 infection, to include problems with the heart and any other organ system. And we continue to learn more about those complications across different age groups. This is one of the reasons that we've said this should be taken very seriously and can be unpredictable what the outcome is in any individual. We are, though, also beginning to understand that in young children, particularly in children under the age of 10, that there is preliminary evidence that suggests that they are not particularly efficient at spreading the disease, and that they are not as easily infected as other age groups, and that the recovery in young children is actually quite good, that there are unusual complications, long-standing complications. We're aware of, for example, the syndrome of multi-inflammatory system in children. That is a complication, but the vast majority of young children do recover from that without complications. So, to address the question, though, it is still unpredictable. And so, for that reason, we continue to recommend that each and every person is potentially taking a chance if they're not practicing precautions. We do ask young people who are less likely, young people in the teen to a young adult age group, to take precautions to protect older individuals who are more likely to have complications. And as we continue to learn more about this infection, what we do know, though, is that the precautions that are recommended are very effective in preventing spread, and that there are many ways that we can safely reopen if those measures are in place.
Okay. Thank you very much.